Continuing on with the chest herbs, a very common problem for children is common coughs and colds. And this really is intended for common coughs and colds, not for children with a high fever, who are poorly, who are not eating, who are not responding well, who are ill. This is for the children who are running around with a little bit of fever, a bit of a cough, a runny nose, not seriously ill. So it's very important not to use this inappropriately for sick children. If there is any concern, children should be taken for a medical assessment with their medical provider. But for the children who do have a general viral infection, you would want something which would improve coughing up any of the mucus so that it's not a sitting ground for like a reception committee for viruses. So you want to promote the coughing, you want to promote the immune system. To soothe a harsh cough would be a very nice thing to do. The demulcent is a nice cooling, soothing action, which is also often accompanied by nourishment for the mucous membranes. As always with infections of the upper respiratory tract, you want to soothe and aid the digestion so that the body can use the resources for fighting off infection rather than the active energy that's required for complex digestion. And you also want to promote sweating. Again, this is to avoid the excesses of fever, which might not be helpful, and to cool the child. So the herbs that have these actions would be marshmallow leaf. This is the original marshmallow, obviously without the pink colouring and all the sugar added. It's a lovely, soft, downy leaf, very soothing for the digestion and very soothing for the respiratory tract. Hyssop is a sweaty herb, it promotes coughing, and it's also antispasmodic. Some reports show that the hyssop oil is dangerous for children, particularly with epilepsy, but this is only applied to the hyssop oil. So the hyssop itself is commonly used in teas and is very, very safe in children. Elderflower we've already talked about, antiviral, mucous membrane support, relaxing to the muscles and antiviral effect. Licorice is a demulcent expectorant, anti-inflammatory, anti-stress and antiviral, and the thyme is antimicrobial and expectorant. All of these are food ingredients, and it's also important to note that there is no cough or mucus suppression in any of these ingredients. If anything, they promote the production of mucus in order to eliminate toxins and break down products from viruses or bacteria. And the coughing is an effective mechanism for eliminating these. It makes for a very soothing and supportive blend of herbs for children with common cold viruses causing a cough. These are a blend of herbs for soothing children. Usually when they are at risk of developing a cough or a cold, when other children around them are full of coughs and colds. Also, I would use this after any of the immunizations that can cause cold-like symptoms. So it's very supportive for teething also, for viral illnesses, for any upset tummy, and for post-vaccination fretfulness or mild discomfort or cold-like symptoms after a virus. Catmint is used in the same way as peppermint is for older people. Catmint is less stimulating. In fact, it has a calming influence. But otherwise, it has the same actions in soothing the digestion and promoting sweating in particular. Chamomile is, of course, soothing for the gut, also calming for the nervous system. It is antispasmodic, anti-allergy, and also antimicrobial. So a very gentle herb, very suitable for children. Elderflower, again, we know that this has an antiviral action, also promoting the nourishment of the mucous membranes and the function of the mucous membranes, and has a very gentle effect. Yarrow, again, is the diaphoretic, antimicrobial, slightly bitter effect, and the plantain is nourishing for the mucous membranes and supportive for all of the functions of mucous membranes. The cough and cold blend is for adults with the usual coughs or colds, not particularly going on to influenza, not particularly prone to chest infections. And it contains echinacea, which has immune modulating effect and also has a blood clearing effect. Eyebright has the anti-catarrhal, anti-allergy, and astringent effect, particularly in the mucous membranes. Sage is antimicrobial. It has high resins. These are high molecular sticky molecules, and if you feel the texture of a sage leaf, it has a sticky effect. This makes it particularly good for sore throats, and you can actually gargle this cough and cold blend just to increase the exposure of the tonsils. And of course, as a gargle, it will get into the little crevices in the throat. So, particularly good for the coughs and colds that tend to linger with sore throats, or sore throats are part of the first symptoms of coughs and colds. Elderflower and yarrow, we've discussed before, so you can see why the cough and cold blend would be very supportive for upper respiratory tract infections.